Hey, Dr. Osborne here with Pick Dr. Osborne's Brain. Tonight, special topic, we're going to be talking about pain medications and the side effects that these drugs can have if you're taking them. A lot of people are taking medications for chronic pain scenarios. So whether you've got chronic muscle, joint pain, neurological pain, doesn't matter, autoimmune pain, if you're taking certain types of medications, you just need to be aware of the potential side effects, because when you're aware, you can make better decisions and not create vicious cycles. So as we talk about this, drawing I've got behind the board. So most people, we've got different kinds and different classes of medications. There's the NSAIDs, the non-steroidal anti-inflammatory drugs. These typically include, most people have heard of aspirin, ibuprofen, naproxen, and Celebrex. This class of medication commonly used for pain, minor pain, aches and pains, if you will. And what I want you to understand is that there are about 13,500 deaths per year as a result of using these medications. So at last count, I think it was 13,600 people annually die from this class of medication. And I'm not talking about overdosing, I'm talking about proper use. So it's important that you understand these drugs can be very, very dangerous. They do cause deaths. And one of the ways that they can create problems is this particular class of medication can cause erosions in the esophageal, in the stomach, and in the small intestinal lining, and that can lead to bleeding. Occult blood loss is very, very common when using these medicines. That's why if you flip it over and look at the warnings on the package, it says, please take this medicine with food, and it also tells you this medication can cause ulceration and gastric bleeding. So understand that those are very, very real side effects. Now that bleeding, that GI erosion, can lead to a leaky gut, and that is one of the precursors for autoimmune disease, and it's also a precursor for many people's chronic pain syndromes. So obviously we don't want to get into the habit of using these on a regular basis to mitigate or manage pain. We want to find out where that pain is coming from. Now, that's really the big question of the night, is where does the pain come from? It comes from inflammation. So if we can understand the origin of the inflammation, where's the inflammation actually coming from, then we don't need to use things to block inflammation, because we can make the adjustment on whatever it is that's creating the inflammation. In my experience, for most people, what creates the inflammation is their food, their diets. They're eating either toxic foods, they're eating foods they're allergic to, they're eating food additives that are creating an inflammatory response, or being exposed to pesticides. So food as a category is a very, very big trigger for inflammation. Another trigger for inflammation can be chemical exposure. Chemicals, examples, household cleaners are a perfect example. Some of these toxic compounds that are used for many people, perfect examples, a lot of these aroma agents can create or trigger migraine pain. So again, chemical exposures, that's just an example. Other chemicals like heavy metals, other chemicals like mycotoxins. Mycotoxins are a form of biological chemical. So if you've got mold in your home, that's a chemical byproduct of mold that can create chronic pain scenarios as well. So we've got food, we've got chemicals, then we've got infection or microbiome disturbances. So a lot of times the inflammation can come from abnormal bacteria, abnormal yeast overgrowth, parasitic infections, viral infections. So again, infection can create an inflammatory response, and if you have chronic inflammation and you don't know why, if you have chronic pain and you don't know why, ask your doctor to run tests to try to rule out different levels of infectious microorganisms. Again, the fourth trigger that we commonly see that is responsible for increasing inflammation is nutritional deficit. So vitamin, mineral deficiencies, essential fatty acid deficiencies can all be triggers for chronic inflammation. So again, if you have chronic pain, chronic inflammation, you're taking medications like NSAIDs, and nobody's ever tested you for those things. That's step one. You got to get those things taken care of, because your body doesn't have pain because you have a deficiency of these medicines, and your body doesn't have pain because you are artificially blocking inflammation. We've got to find the origin and the cause. That's what functional medicine is all about. So again, if we look at leaky gut, where I left off here, we look at the bleeding side effect of the non-steroidals. Remember, occult blood loss is a common cause of anemia, and that means you're not getting enough oxygen. When you have iron deficiency through blood loss, then what happens is you can't make hemoglobin, which is the protein that carries oxygen. And when your oxygen levels start to drop, if your brain doesn't get enough oxygen, if your muscles don't get enough oxygen, guess what? That can create pain scenarios. Lack of oxygen to the muscle forces the muscle to produce energy through anaerobic metabolism. What that means, anaerobic metabolism means that when the muscle is creating energy, it also creates a side effect byproduct called lactic acid that can create chronic pain. So if your muscles are chronically achy, like you've worked out, you might consider having your doctor check you for blood loss, occult blood loss, as well as different forms of anemia. Now, a couple of other side effects of non-steroidals: they can interfere with vitamin C. They can also create folate metabolism problems. What I want you to understand and why that's important is that vitamin C deficiency and folate deficiency contribute to an inability to repair and heal cartilage. So if you've actually got a joint problem where it's a cartilage degradation, a cartilage deterioration, a lack of these two nutrients can make it very, very difficult, very, very challenging for your body to heal. So by taking the medicine to reduce the pain, you actually inhibit your body's healing response. Again, it's a lose scenario. You don't come out on top. You may get a temporary, transient fixation of your pain or reduction of your pain, but you don't get an outcome that serves you. You get an outcome that makes you, in essence, a slave to having to use the medicine indefinitely. Now, there's another class of pain inflammation reducing medicines. Those are steroids. Now, if you've ever heard of a corticosteroid, these drugs in particular are used very, very commonly in autoimmune disorders. They're used, like rheumatoid arthritis or lupus, when somebody suffers with really long-term chronic pain. And they use these drugs to basically to subdue inflammation. That's what steroids do. The problem with using steroids long-term is that they can contribute to muscle loss. Steroids are a catabolic hormone, so long-term use of corticosteroids actually causes muscle loss, causes bone loss, and that in and of itself, when you have muscle loss, remember what happens to your metabolism when you have less muscle? Is it slows down. So now you can start to gain weight. So steroids can cause you to gain weight through muscle loss. Steroids can also cause you to gain weight through fat storage. So again, there's two mechanisms of weight gain here as it relates to corticosteroids. Now, nutritionally speaking, this class of medication can cause vitamin C deficiency, vitamin D, calcium, and magnesium deficiencies. Why is that important to understand? If you're taking a steroid and you're blocking your pain, know that when you block vitamin D deficiency all by itself can cause pain. As a matter of fact, some research shows that vitamin D deficiency triggers autoimmune pain. So, especially as it relates to rheumatoid arthritis and lupus. So if you have been diagnosed with one of those two and your doctors are not checking your vitamin D level, your 25-OHD level, it's very, very imperative that you get this checked. And if you're on a steroid and you haven't weaned off a steroid properly, or you're thinking about getting off the steroid and your doctor's working with you to wean it down, or if there's no end in sight, you ask your doctor to measure and monitor your vitamin D levels as you're going through that process. Calcium and magnesium are electrolytes. They're minerals, and what they do is they help your muscles contract and relax. Okay, and a calcium magnesium deficiency will actually force or cause your muscles to be tighter. Now, when that happens, your muscles get tighter, it creates a compression. Okay, a compression of the muscles. So the muscles compressing the joint. So now the joint itself, think about this from that perspective. The joint itself becomes compressed, and if you've gained weight and the joint is compressed, you've added weight to a compressed joint. Now you have more force on that joint, more load on that joint. And so that if you're already hurting, if you've already got arthritis, it's just going to contribute to more pain. And so when we have more pain, what do we tend to do? We tend to not exercise, right? And one of the factors in helping control inflammation is exercise. Exercise is very, very critical to help people control inflammation. So what happens is when people avoid exercise as a result of pain, they gain more weight, right? And so when they gain more weight, what do? They avoid exercise even more, or they become exercise intolerant and they end up gaining even more weight. And so again, more weight gain, you're using a medicine that causes more weight gain, you're using medicines that are causing nutritional deficiencies. It's a vicious cycle that you can get stuck in. Very, very dangerous. And one of the other classes of medications are the opiates. And the opiates kill, at last check, I think it was in essence or in excess of 20,000 people per year. And that, again, is not from accidental overdose. That's from purposeful use appropriately. These drugs can be very, very dangerous. And one of the side effects of these medications, they can slow down your GI motility, okay, creating constipation. And that one of the problems with long-term constipation, especially if you're mixing opiates with NSAIDs, which a lot of times doctors will do, they'll mix these two categories of medications. And the reason why is they want to lower your need for this one and hoping that this will work well enough. But when you cause constipation, okay, or GI motility slowdown, and you're also taking this medication, remember this can cause, it irritates the GI lining and causes erosion. So you slow down the gut so that this medicine stays in the gut longer, has the potential to even create more damage. So you have to be really, really careful about that particular combination. And again, it's the intelligent thing to do is have an open, honest conversation with your doctor if he's got you doing that combination. Now the constipation, the other problem here is that when you eat, if you're constipated, that food is not digesting. And so if you've created a leaky gut as a result of those erosions, then that non-digested food or that slow to digest food, some of the particles, some of the bacteria, some of the other things that can be toxins that are supposed to stay in your gut is a lot like Vegas. What happens in the gut is supposed to stay in the gut, but when you have a leaky gut, those toxins can leak from the GI tract into your bloodstream, creating havoc for your liver and your kidney and your other organs as well. So when you create a constipatory effect and you have leaky gut, you allow those foods that are not being properly digested and some of the other agents within those foods that can be dangerous to leak across the GI tract barrier and get access to your bloodstream. Not a good combination as it relates to that. So big problem with these medications. As a matter of fact, I think I quoted this the other day. I have a quote from one of the directors of the CDC. He says directly, this is his quote, "We know of no other medication routinely used for a non-fatal condition that kills patients so frequently. We hope to see fewer deaths from opiates. That's the bottom line. These are really dangerous medications that carry the risk of addiction and death." Not my words, the director of the CDC, his words. So if you're on this medication, and I'm not talking about people who are being treated for terminal cancer or people who have had severe traumatic injury. That's not who I'm talking about. I'm talking about people who have chronic pain scenarios and they've never investigated the root cause, the potential for root cause, which is inflammation. Now, there's another class of medications oftentimes used to treat pain in rheumatological or in autoimmune diseases, and these drugs can suppress the immune system. One of the side effects to this class of medication is cancer, lymphoma. There's a big black box warning on this class of on these classes of medications that state that taking this drug can actually increase the risk for lymphoma as well as chronic infection. So these drugs also have the potential to create a susceptibility to infection. Again, let's go back and think about all the things that I said that trigger inflammation. We said that food can do it. We said that vitamin and mineral deficiencies can do it. We said that chemical exposures can do it, and we said that infections can do it. Now, if we look at the course of what these pain medications can do, this class of medication can cause a leaky gut, which allows your food to penetrate the barrier, creating an inflammation process. This class of medication can create inflammation within the gut by eroding the mucosal barrier. It can also cause vitamin deficiencies, vitamins that are necessary to regulate inflammation. So, again, if we're trying to figure out why the pain is there, but we're using a drug that can actually create a scenario of enhanced inflammation, where are we winning? Steroids create muscle loss, bone loss leading to exercise intolerance, exercise avoidance, create vitamin and mineral deficiencies that can also trigger chronic pain syndromes. Opiates can trigger constipation, which leads to the potential for those toxic agents in your food to have more access to your bloodstream, but also the danger of just being on these medications in general. Deaths, very, very high risk, and addiction. And in that, in and of itself, many people get addicted to this class of medications and it can destroy their life. Then we have immune suppressants that can create lymphoma and chronic infection. Remember, again, chronic infection creates inflammation. So if we look at all these medicines, if we look at what we're trying to accomplish, and doctors are trying to accomplish, is they're trying to accomplish compassionate pain relief, right? Compassionate pain relief. But is it compassionate to give a person a medicine that's going to force a continued cycle that their pain never actually is addressed, that the origin of their pain never is actually addressed, but then the medication side effects over time can create more reasons that that person might experience more inflammation, therefore more pain. And that's what you have to think about. So make sure you click right up here for part 2 of this video. I'll discuss more of what you need to know about taking pain medications. This is Dr. Osborne. I'll see you in the next clip.